Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, with today's guest, I want you to think about this question. If you're a clinician, how do you know what regenerative products can actually be trusted in the industry? And today's guest, Brittany Bracamonte of Opulence Regenerative Medical, works directly with practices to answer that question, guiding decisions that impact patient safety, outcomes, and long-term growth. So I'm excited to hear what she has to say. But before we jump into the episode, just a quick message from our sponsor, Growth Solutions, where we believe every healthcare professional deserves an exceptional growth partner to match their ambition and reach their business potential. Growth Solutions takes a diagnostic approach to your business. We look to analyze and find some where there might be leaks in your time or money or leads or opportunities or whatever may be causing kind of some stagnancy in the business. We help eliminate stressors in the business, such as new patient or client acquisitions, marketing and growth strategies, reducing operational chaos, and with proven systems and frameworks and SOPs, and understanding which AI systems and agents you should plug into the business because the robots are coming for us, whether we like it or not. So Growth Solutions is not an agency or vendor. We are your growth partner. So if you've ever thought this, I'm too busy to grow, I'm too slow to scale, or I'm too overwhelmed to fix it, we are your growth solution. So drop the word grow below. We can set up a free consultation if you like, but otherwise you came here for the reason to listen to our amazing guest today and what she has to talk about regenerative medicine. So Brittany, welcome to the Prime Health Podcast, and please do tell us a little about yourself and what you do.
Sure. Thank you so much for having me, Derek. As you mentioned, my name is Brittany Bracamonte, and I'm the owner of Opulence Regenerative Medical. My distributorship strives and is successful at bringing providers the resources and tools and new medicine today that everyone is striving for, right? So we don't work with just one tissue product, one lab. We truly source and vet the key partnerships with pioneering leaders in this space to, again, bring practitioners the best science, the best data, which hold the most efficacy for clinical-based outcomes and, really just proven results. So that's something we really strive for and we're successful at and really building those partnerships with like-minded physicians and people in the space to achieve what I believe is a common goal, right? And to see new medicine through, regenerative medicine, in the way that we all kind of have the same vision and curiosity and eagerness for, right? And part of that, as you mentioned, is really finding a way to set ourselves apart and building out trusted relationships that are valuable and just really showing and bringing physicians in a space that sometimes they might be weary or untrusting or questionable as to who to trust or what products to believe are going to drive the outcomes and results that they're looking for. So whether it's a combination of practice growth, elevated modality applications, I think it all kind of comes down back to finding the right partners and trusted resources, products that hold efficacy, and where to vet that and how, right?
Yeah. Well, thank you for sharing that. We'll get into a bunch of questions. We'll kind of dig a little bit deeper into each of those at that point. But I always do ask people kind of at the start was there a moment that you said, you know what, regenerative medicine is so interesting? What made you kind of jump into that portion of your career?
Sure. There was a kind of nostalgia type storyline that comes to mind from a conversation early in my career that really in a nutshell what the summary of the conversation was when looking towards, what do you want to work towards? What do you want to be impactful by? Whether you know what your long-term career as a physician looks like or as a distributor, whatever specialty or endeavor that you're pursuing with enough seriousness, there needs to be some commonality and some goal there. And I think that really what mentality I adopted pretty early on from being in the space of regenerative medicine particularly was really just to be an impact and to be a contribution to that change of evolving medicine and technologies, and just really to make it the world a better place. As corny as that might sound, that's kind of the best way that I know how to say it, is just that's what we're all working towards, is to bring patients and providers the regenerative new medicine and being a part of that contribution.
Yeah. I appreciate that. There are too many people that are out there that, trust is a big word. I'm going to ask you a little bit later even more about that, but they just don't know where to go. They need the trusted source like you spoke of. And there's so many people knocking on doors nowadays saying, hey, we have this for you. This will change your practice. But it really becomes down to the relationship that you build with them. And I'm sure that you do a fantastic job with your clients.
So sorry, could you repeat the question you were asking?
Yeah, I'm just saying that I think by what you're bringing up, Brittany, it's a great thing. Trust is important as we go about this. We'll go a little bit deeper into that question a little later, but I think it's important for people that when they work with distributors like yourself to understand that your goal is to help them eventually build and grow their business, as you said. But the bottom line is you want to provide them with a product that's the best for their patients to give them the outcome that they look for.
Right, that's correct. And to highlight on what you just said, yes, it is my goal to establish the trusting relationship early on, because otherwise there's no foundation of the relationship to begin with. But it is one of the first, probably in the first, sentence or two of every conversation that I have with a practitioner specifically, is they just say, I don't know who to trust, because I don't like using the word saturated in this space, because I think that dilutes it overall. But it is a growing dynamic space where a lot of different entities are trying to get involved in regenerative medicine. And there's essentially a lot of policing of cowboys, right? So I understand that the struggle amongst practitioners of who to listen to when they're so busy with clinical care, and there's just only so much extended time of research and whatnot that you can do. And so it is something that I try and I'm successful at achieving early on, is establishing that trust. And with every new relationship, partnership, or connection encounter that I have, that looks differently. But really, I think what it comes down to is showing your potential partnerships or new clients that the most important thing here is not getting an order or a sale, right? Because they're just in search of looking for information that they haven't been given yet from anyone else. So what does that look like for you?
That's a great lead-in question that you talk about with them, I'm sure, because you want to help them ultimately. So, I mean, this brings me to my next question. As a distributor in regenerative medicine, Brittany, what does kind of the vetting process look like when choosing new products in an office to deliver? How do you set up the right partnership, choosing the right technology, ensuring that it meets quality and safety standards for the clients? How do you help them with that?
That's a great question. And it looks differently amongst each partnership or product or contract that I decide to sell, this lab's exosomes versus, a piece of capital equipment. And that process looks different amongst every industry or category. But what I would say it comes down to is asking questions. Just keep asking questions. Even if you don't know what you're asking for, we wouldn't be asking questions if we already knew the answers, right? So just continuing to ask questions, even if it's beyond something that you think you may or may not understand. So for example, I am a distributor for exosomes and stem cells, which are seemingly a conflict in the industry or understanding where they lie in which category. just asking questions and really going straight to the science, right? So a lot of conversations that I have beyond that, I don't know who to trust or listen to. I don't know which science is real. I can't tell the difference between sales and real time data. What I always advise my practitioners is to go straight to the science. Let's leapfrog all of the middle ground stuff. Stop pulling up all these order forms and brochures that you've had dropped off at your front door. It's marketing material. Yeah. Let's dial back and go back to thinking the way that we should have always been able to outside of the facade after graduating medical school, reading numbers on a piece of paper. Let's go straight to the data and let's look at the science. And I think that once we establish success with recalibrating our way of thinking forward, or the way that we make decisions or vet certain processes, you'll be surprised, and practitioners are surprised at what they'll find and start to clear out, if that makes sense.
Yeah, it does. I think it leads into where many of your clients or potential clients that you speak with, they're dealing with challenges. And I think the one challenge that you hit on is they've got many people knocking on their door, dropping off marketing material, and one looks just as good as the next. One's a little bit shinier than the other. And what does it do? And that's where somebody with your skill set and your knowledge comes into play that says, hey, these are some of the challenges. Let me point you in the right direction moving forward. Let's break it down to, as you were saying. So if that was me, you and I having that conversation, can you walk me through how you would get through some of those big challenges with myself?
Right. And I can think of, I guess, just a couple of silly to the point conversations that I've had to highlight directly on that. So I've been on the phone with a practitioner where I'm following up from a previous inquiry or conversation that we had about, what I have to offer, if they're interested, how I could be of more value in providing them more specific information, or what they're in search of. How can I be of value to you? What do you need? What are you looking for? Because there's, my toolbox is so large that there's no question that's too big or too small. And I can remember laughing, looking back a few conversations where I could almost visualize them pulling out a stack of marketing material that they've had and start comparing with me. Well, this person is their cell count or their exosome count is this much more than what yours is showing. And I have to creatively and charismatically figure out a way to redial them back to the way of thinking. Like, let's take some steps backwards here. What you're reading is marketing. We all have it because it's necessary, but the tweaking of numbers is nowhere in line of what you should be scaling your products and what you choose to use in clinical practice with comparatively, right? Sure. So it kind of seems, and every conversation is different. What are they looking at? What is their motive? Or, and I'm just very good at reading my clients and connecting with people on that end to reconfigure the way that we're thinking or what we're looking at to make decisions, right? Yeah. Usually pretty successful, but not always. But
yeah. So if I can, again, a clinic owner listening right now, or if they're watching this, whatever it may be, can you give us, is there a 1, a 2, a 3, key points that they should take into consideration before bringing in that new exosome or stem cell product? I know they're probably unique for each type of, whether it's exosomes or whether it's stem cells, but is there a few key points that you would always want to drive them to solidify themselves in?
Sure. That's a great question. The first is, have you received all of the, do you have the information personally and as a clinician under your license that you're confidently using this product with the most information possible to be treating or using in clinical use confidently, right? It kind of circles back to the license holder or the clinician. So do you have all of your questions answered? Because it seems to me that most of the time they don't. And I'm not sure at what point in the sales process it happens that they decide to use a product versus continue to search. but are you educated enough to be confidently using this in clinical care, right? The second question would be, have you vetted or obtained enough clinical-based outcomes or had enough conversations to know that you're going to be successful in using it in clinical practice? The third, I mean, there's several, right? The vetting process is broad.
Yeah.
But if I were to say a third, have you used it yourself?
Oh, very good.
I think that most physicians that I've been encountered with who are confidently and successfully using biologics or regenerative medicine in practice will say, I wouldn't use this on a patient unless I was, if I had successfully and confidently used it on myself with good outcomes. I think that's important too. Always try something before you adopt it in patient care.
Yeah. Those are three great points that you bring up. And I want to give you the ability to brag about yourself a little bit if I can, with this statement I say. So if I'm listening, those are three key points that are important to me. What do you say you do different, Brittany, than another vendor or another product representative that comes in? Like what makes you stand apart from some of the other competition that you know that's out there?
Well, I don't necessarily focus on other competition as much as I do just trying to build out the ethical standards that my group and company hold to. But it goes back to the trust, right? So it's more important to us as far as the relationship and trust building process goes to make sure that the practitioner knows that our core value and priority is to bring them the resources and get the answers for them that they're searching for, right? Before asking for a sale or asking for the business. And I think that is very much more foundational long-term and short-term than anything else. So what sets us apart is that we do the hard work, right? We don't just partner with, the next best enticing proposal or pitch of somebody who wants me to sell their product or me and my team because it brings us the most value. That's not what's important. What's important is clinical-based outcomes and the practitioner's success in their clinic, which is evolving and continuing to follow the speed of evolutionizing new medicine. And so bringing them resources. Furthermore, again, if I don't have the answer, I will, I'm not dishonest. I'm not scared or afraid to say I'm not sure, but I will find out for you. And whether that means that I need to find or resource one of my practitioners who has been having successful clinical outcomes with, orthopedic applications or something specifically in men or women's health and aesthetics. I have a very good network of resources that I can take them to the right person and have that conversation and connection that goes beyond just speaking to somebody who's in sales.
Yeah. Yeah. It's in healthcare, the end user, the patient is what's important, but you have to have a great relationship. And
Right.
we hit on the word trust quite a bit already on that. But again, we talked a little bit, you've got a great kind of a success story of somebody that you worked with where they had questions, they weren't sure. And I think some people would position themselves to make a sale. It doesn't sound like that's how you positioned yourself. You wanted to get that physician the most information that could help him make the best choice. Would you mind sharing that kind of success story that you discussed?
Absolutely. Thanks for highlighting on that. So that was a good success story. I have been in talks with a physician in California. He is by specialty in plastic surgeon and now gravitating into regenerative medicine. So I think he has been successfully using some biologics as far as exosomes and stem cells, but really tapping into the peptides side of the industry. So we had been in conversations and I quickly picked up that maybe he had some bad experience with sales reps or some misinformation, just not a lot of trusting foundation so far. So instead of trying to push any further on the efforts that didn't really seem to be evolving between he and I said, look, I think I need to take you to a true valuable resource, which is another clinician successfully using peptides in their regenerative applications, and connect you with them to show that it wasn't as important to me to get the business as it was to get him the answers directly from who he wanted to hear it from. So I set us up on a peer call with one of my referring physicians in Henderson, Nevada. And it was a very successful, very fruitful call. They have a great connection now. And after we got off the call, he phoned me afterwards and said, thank you so much. That was exactly what I was looking for. And you took me exactly to the answer that I could have really hoped for. So thank you. And it was a complete different change of trajectory of conversation and tone to saying, that's what I was looking for. Thank you. And now we are continuing to collaborate. So
yeah. Good on you for that. It's in medical sales. Regardless of what it is, it's great to make a sale, but I think the relationship is what's best to make. You don't always make a sale call number one. You make a sale later on, but that relationship you built with the physician and the one that you put in touch with the other doc helped both of them, I'm sure, in the long run as well. So it sounds like a triple win, if you wish. What do you think most clinics are getting wrong right now when it comes to implementing regenerative therapies?
I believe, I don't know if saying getting it wrong is the right verbiage, but more so what are they relying on as a news resource, right? Is it, where are you getting your feed? Are you asking the right questions to get in connection with the right people? And I realize it's hard to find those pioneering right resources, but are we looking on LinkedIn for the right conversations, questions, and answers from the correct resources? Are we getting the right insight as to who's navigating the industry and which way they're going? A lot of it is the news resource to me, if that makes sense. And we can elaborate on that a little bit further. But the other side of that answer is really just narratives that don't hold suffice backing. That makes sense. So I've noticed there's a lot of game of misinformation as far as regulation and compliance. Like you constantly hear, well, stem cells are illegal in the United States. I think it was just yesterday I was talking to a family member who's looking to receive a regenerative application from a physician in Missouri. And she told me she was listening to a podcast interview of somebody saying, well, these products are illegal in the United States and can't get them there. So there's a lot of misinformation in our usage of words and compliance, and understanding that's confusing and causes the wrong narrative and connotation to the next peer that you have a conversation with.
Yeah. And
so really trying to source and find the right people who have the right information to listen to is important. And it starts with here, right?
Yeah. So if you would expand on a little bit of, where they're getting their sources from. Again, when you get it from a marketer, you always have to question that. There's true intent behind it, but what would you do to point them in the right direction of where they should get their sources from?
This might be one that we have to circle back on a question towards the end, but it's not, come to me, come to, some of my pioneering physicians. Like I can always, if it's a practitioner, I can always get them to the right clinician. Correct. Okay. I have enough relationships and vetted doctors who've been using regenerative medicine in clinical care for long enough that, the white papers are there, the studies are there. There's no more question. It's like for so long, we've all been saying as a community and as people outside of being physicians that we all know that this is not hocus pocus medicine anymore, right? Whether or not you believe or disbelieve that there are doctors in the US who are successfully using these applications, it's in Switzerland, it's in Mexico, Panama, whatever your extent of research has been. So whether or not it's true and exists, it has been successful in several different illnesses and in targeted regenerative applications. I believe we're beyond the questioning of that. So I think when it comes to thereafter is just to keep asking questions and keep looking. And that's really what people are doing in as patients and as physicians. They're searching. So I would say, again, back to the answer of a previous question, learning how to not let the noise be a distraction and leapfrogging the misinformation and unnecessary information into going directly to the science.
Yeah. Yeah.
And whether or not that you know what that looks like, we don't know what it looks like until you start asking, because we haven't been there before. But just keep looking. Look for answers that you don't know, because you will find them.
It's not necessarily a pioneering medical arena anymore. It is on what we can do here in the States, because as you're saying, Switzerland, I know some people have been going to Italy for that. Professional athletes, Kobe Bryant many years ago had to leave the States for that. Well, those are coming back. Medical tourism is actually now starting to come to the States versus going to other places. So it's interesting. More physicians would be busier if patients had better answers. And right now, when they're getting it on TikTok, it's not always the best answer. It's great if you can go to a trusted resource for that, which I'm sure that your company is that for the physician, which is probably where you do more of your education than for the patients. But there has to be good people out there that are, from an influencer standpoint, I'm sure, sharing that with them. So I know you have got a bunch of different vast kind of clientele. Can you read what types of physicians or clinics have you worked with in the past?
Oh, I've worked with any and every specialty, probably outside of pediatrics and maybe dental.
Oh, wow.
I would say about 8 years ago was when the brink of my career in regenerative medicine really kind of elevated and took off. And I noticed a change in trajectory probably 4 years ago now, that when I first worked in regenerative medicine, it was aesthetics and orthopedics and maybe pain doctors primarily. And by default, I kind of gravitated towards derms for some reason. I always have. But I've noticed over the last 3 or 4 years, there's been a big change in trajectory. And again, it's stimulated from an interest of our economy as a whole, whether it's being a physician who wants to elevate and expand on their patient outcomes. And of course they do. Doctors went to medical school because they wanted to be successful and continue elevating on getting people better, right? Yep. So they're following what they're biologically and instinctually have always wanted to do. So they're curious, they're hungry, they want to have better success, they want to follow that technology. So I've noticed a change in trajectory that a few years ago I started to all of a sudden get calls from internists and what's another, even some ophthalmologists. And it was really interesting and fun to kind of see that turnkey of new medicine flooding into multiple specialties outside of what was the norm or conformed of. So typically I work with all kinds of different specialties, from med spa and orthopedics, plastic surgeons. But primarily I would say plastics, dermatology, orthopedics, med spa, and pain medicine doctors is who I work with the most. Okay. And not that I choose or pick or target one over the other. It's just, whatever connections and the place and time take me to. So.
Yeah. I was speaking with an orthopedic surgeon actually just this past weekend at my son's lacrosse game. And I was asking about peptides. I was asking about, PRP. I was asking about biologics. And he was an older gentleman. He's, maybe 3 years away from retirement. And he goes, boy, I really wish that I was just getting into practice like his son is, because he said there's so many more options. If I'm just going to do a meniscal repair, what I could do for that patient today than what I could do for myself 5 years ago, 10 years ago, 25 years ago. So it was interesting to hear from a gentleman that was later on in his career how he would like to open that up. And I'm sure that's the same for a dermatologist, an internist, a pain medicine physician. As you said, Brittany, you work with people that want to give better outcomes to their patients. And what better way by offering orthobiologics and regenerative medicine?
Right. Every doctor, every physician, every person, in my peers, it's every conversation. It's every conversation. And I'll even go as far as to say that it's every conversation. Everyone has the same curiosity. No one is settling for the answers that are not there yet. So we just have to keep asking more questions. We have to keep being hungry. We have to keep being more rapidly adaptable forward thinkers in today's world. I mean, that's really what it comes down to. If we're going to see a breakthrough and some real evolutionary changes, right? I'll even go as far as to say from, kind of speaking to a patient, if there's any viewers or listeners out there, a couple of conversations that I've had with some peers lately, I said, imagine a world that in, 10, 15, 20 years, maybe less than that, our kids are no longer living in the same world that we did, and that heaven forbid one of them at the age of 20 or 25 get diagnosed with cancer or Lyme's disease, that their first train of thought is no longer, oh my gosh, I've just lost 40, 50, 60% of my quality or of life. But that's not their first train of thought. They immediately think, no, there's doctors who are successfully treating that. And that my first option is I have the resources to seek them in the United States or wherever they might be. And it's a crazy thought to some of us in our generation, or who haven't quite tapped into what's here and now, but it is. And so as people of the public or of the country, and as physicians, we have to collaboratively work together in moving that needle forward if we want to see it happen, because it's not a question anymore as to if it exists. It's how do we keep and move it forward to establish that for the future of our children and our world.
And I think what's happening is you're getting many people in the general population that are experiencing situations like that, asking what else can be done. And therefore ask their physician if they didn't know, or if they're doing exosomes or stems or PRP, whatever it may be in their practice, and they're like, okay, this is another option. Or I have a patient that asked me something. I'm going to ask Brittany, or I'm going to ask one of my other individuals, have you had any experience with this kind of a condition? What could we do for them? So the patients are actually pressing the options that are out there, and the physicians want to have an answer, and you have multiple answers, I'm sure, for all the clinicians that you work with.
Yeah, I do.
Yeah, perfect.
And if I don't, then I will find it for them to the best that I can.
Very good. In regards to your business, Brittany, what are you focusing on right now from, let's say, a growth perspective? What are you looking to do to grow in your business?
Right now, my current focus is building out the platform really just for the true value to my practitioners, my current clients that I've existing in, and building out a better platform so that all of the information, all the resources, whether it's peer calls or protocols or handbooks, access to essentially everything that I get asked for in the daily, building out a better platform for that, which I'm expanding on. But thereafter, just continuing to make sure that I'm partnered with the pioneering leaders of science and new medicine, and just making sure that we're following and working with those key players, right?
Yeah. Good.
So that's always the biggest and most forefront priority.
Yeah, love it. Where do you see the vision in your business in the next 3 to 5 years?
3 to 5 years. Well, being a big contribution and part of the evolution and change in new medicine, whatever that may or may not look like, But again, I think it comes down to being the utmost support and valuable to the doctors who are seeking it from the right partnerships and true data, which is what we bring to them.
So if someone listening or watching to this is like, I need to speak with Brittany, or I've got a question that, they may have, or, they have a friend that's looking to get into it, where would you like people to go to learn more about you and ask some questions or potentially work with you?
Sure. So the best place to connect with me and Opulence Regenerative would be on my provider portal, which is a hub, a web app that's the foundation of where I have all of my relationships and sign up essentially are. So you can find my provider portal on LinkedIn, and it's a really quick 5-second sign up, and then I give access, or my team gives access to whatever it is that they might need inside of that secure network.
Okay, perfect. I'll make sure to drop the link in there so it's a quick reach for people to get to that for Brittany. But thank you. Been a great guest, but I do have one last question for you, if I may ask.
Sure.
And that would be, you're in a phenomenal emerging and growing business of orthobiologics and regenerative medicine. And this question kind of goes from anything, but you're a guest on the Prime Health podcast. What is your definition of Prime Health?
My definition of Prime Health, or the Prime Health podcast, is essentially a similar visionary partnership, and that what you as the founder and starter of the organization is seeking just the same thing as the rest of us in being a leader in regenerative medicine or a breakthrough in new technology and making the world a better place. Really, I've had many conversations with you prior to this one, and we're very like-minded and see the same vision and searching for the same thing. So I think what Prime Health is doing is amazing. I think it's a big movement and a big contribution to the outcome of what new medicine and what regenerative biologics are moving towards. So I think it's a great thing and going to make a lot of impact.
Yeah. Well, thank you, Brittany. I appreciate that. I want to thank you very much for being an insightful and a phenomenal guest to help, a little bit of we do from a patient to the general population or to the physicians and clinicians that are out there. You bring a vast knowledge base. And I think probably one of the most important things that, we had mentioned just before we started the podcast and you covered, during that was that success story where when it comes into sales of any sort, it's about making it. And you change that around that, it's possible I may never make a sale from this physician, but I want that physician to make the best choices for himself and his practice, and ultimately the end goal of being the patient. And I think that speaks probably volumes of integrity and ethics in your business. So I just want to point that out. You're more than welcome, dear. But for the viewers and listeners, from what she had to say, there's at least 1, 2, or 3 things that she shared that there are other people in the profession that need to know about. So we asked, just share it with one other person. We always love it if you can share with as many, but we want other people to know what Brittany's doing, how she can help their practice, and eventually, as I say, the end user, which would be their patient. From my perspective, we always are looking for people to subscribe and or share more ideas what we do here on the Prime Health podcast. So we'd appreciate that. And as I wrap up, until next time, remember that true wellness is a journey we are all on together. So whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So I always do say, please stay committed to your Prime Health journey. And again, Brittany, thank you so very much for being an amazing guest here on the Prime Health podcast.
Thank you, Derek. I appreciate it.